Hello everyone and welcome to this audio podcast. This audio podcast as part of the Equipoise. This audio podcast as part of a Lapstorm Motley. This audio podcast as part of a Storm and Scuttle and Turbulence. This audio podcast as part of the Squakish series or edition, and this audio podcast as part of a Storm Lobostics production. Through this audio podcast today, sort of a relook at, or sort of a look at, if you like, in around renal, around renal and nutrition. So, in and to begin with, nutrition in amongst renal diseases or conditions. So, intro of renal-friendly nutrition may help or can help to protect protect the kidneys, protect the kidneys from in around renal insufficiency. The adaptation of healthy nutrition can help preclude or slow glomerular filtration rate GFR. Can help or may help in around in around sort of in around a precluding decline in around GFR or in around GFR glomerular filtration rate in amongst early CKD stages. Recipients with renal disease with renal disease or renal disease uh, renal disease can 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 advantage from an intake of certain forms of nutrition. Healthy nutrition in as protection against the incidence of CKD. So healthy nutrition can include sort of can include for example sort of where there have been a literature to inform in around different forms of nutrition and different forms of nutrition and healthy nutrition typically can involve sort of a high consumption of whole grains, fruits and vegetables, and healthy in around healthy fats, intake of fiber, vitamin C, vitamin E, and carotenoids are and have been evidenced in amongst literature. A lower consumption of salt or sodium and sort of and nutrition with high sort of acid loads can be or have been sort of evidenced as being for have been evidenced as protecting against the sort of incidence of CKD. The A study in around 2019 investigated in around adhering to particular nutrition and where the evidence indicated or informed that it can reduce the odds of particular symptomology burden particular symptomology, burden, and unhealthy, around unhealthy sort of nutrition, and this includes high fats and nutrition that have high refined starches, saturated fats, and trans fatty acids, and high salt or sodium, lower lower uh, sort of a certain nutrition. At the same time, certain nutrition can heighten the inflammatory response, and inflammatory markers, and these can and where certain nutrition can heighten the incidence, again in the incidence in around CKD or chronic kidney disease.